Your patients are going to love that you're on social media. So I was doing a coaching call in our P community a few weeks ago, and we're talking about business, social media stuff. And one of them asked me, so what do my patients think of me being on social media? And I was like, my patients find me on social media. And this contrast really hit hard for me when the difference when I was working in concierge private practice before I went full time into my own practice in social media. And so basically I was getting assigned patients. And then when I was getting assigned patients, they basically would come in and they would have no relationship with me. So no expectation, but no relationship with me either. And when you go into psychiatric care, normally you're a little bit apprehensive. You might be nervous. You might be distrusting of the provider, especially if you've had bad experiences. I remember this one time, this lady, 40s, came in with her daughter who has autism, who was maybe in her mid teens. And the daughter has problems with agitation, aggression. And so immediately the mom walks in and she has this discerning look on her face. And I introduced myself and then she asked me, "Oh, okay, what medical school did you go to?" So I answered. Then she's like, "Are you qualified or what residency did you go to?" So I answered. And then she was like, "Are you qualified? Do you have the qualifications to treat my daughter? She's very complex." And so I sensed what was going on, right? And it said, "Listen, ma'am, right? Like I know that I look young, but I promise you I have the full classifications, right? I did a full psychiatric residency. I did a child and adolescent fellowship. I'm well experienced in treating autism, the aggression, especially agitation. And so I can help your daughter." And so then she visibly relaxed, and then the interview got on to a much better foot. But the thing is that I had to earn her trust in that interview. And so she already came in with kind of a negative bias, right? Whereas when I get a patient from social media, they've consumed my content, whether it's on TikTok, Instagram, YouTube, live stream. And so now they come in already having a relationship with me, like in their head, not a doctor patient relationship, right? That's a very clear distinction, but like they have some knowledge of me. And so if they come to my practice, it means they already like me. Otherwise, they wouldn't come and want to work with me. So now I have the advantage that the patient already likes me. They chose to work with me. Just if you go to see Taylor Swift, you obviously like Taylor Swift in concert. So now if a patient comes to see me, that means that they are going to be more warm and receptive towards me. So the interaction is going to go better. It means that they are going to be more likely to trust in what I say. It means that they're going to be able to more likely to follow what I say. And that means they're more likely to get better with what I say. So that means that my patient outcomes from being on social media are going to be better than other psychiatrists, even if we do the exact same intervention, because the patients like me, they trust me, and they will follow my recommendations. There's a concept in psychiatry, we call it therapeutic alliance, which basically is the strength of the relationship between the patient and the therapist or the psychiatrist or the clinician. And so the stronger that alliance is, data shows that the better outcomes that patients get. In the therapy literature, we know that it's not the type of therapy that matters. For example, if you do cognitive behavioral therapy or dialectical behavioral therapy, as much as the relationship between the client, the patient, and the therapist. So that's actually a huge advantage of being on social media. And it's the complete opposite of what doctors think, because they think that, oh, yeah, my patients are going to think it's weird, or they're going to think it's cringe, or they're going to judge me for it. And I think there's a way to do it too. If you're just showing off, like, oh, yeah, here's my watch and car and a day in the life, here's how hot I look with this new outfit, then maybe that's not going to help you as much with the clinical stuff. But if you create the content that I advise doctors to create, which is educational content, basically sharing the knowledge of their specialty, then like you're only going to attract people who are drawn to you for that. So you can leverage that however you want, whether it's you have a book that you're selling or you have a practice that you're promoting. Dr. Miami, for example, right, big name on social media, he has a plastic surgery practice that his patients get directed to come to his practice, right? Yeah, patients will, they're going to love it. And I think it's a limiting belief that doctors have in their heads that the social media is going to be detrimental. You think about it from like a celebrity point of view. You People like Taylor Swift and other artists, Bad Bunny or whatever, but they've never interacted with these people. They've never spent time with them. They've just absorbed their content, their social media. So whether it's music or Instagram posts or podcasts or whatever, right? Like that stuff, they develop this relationship with that person. And so that's why people will fly across the country or across continents to attend a Taylor Swift concert, even though they've never met her, because she spoke to them like in her music or interviews or whatever it might be. And so, point being is that, especially if done right, your patients are going to love you being on social media. Something I do a lot now is, let's say I talk about, for example, I have a supplement protocol that I recommend to patients who, if I'm trying to help their testosterone get better, and instead of explaining it each visit, I'll just say, hey, I'm going to send you a video and just watch the video. And it's a video that I've made. I had another patient, so I was teaching them image rehearsal therapy for nightmares. And so we were working on that. But so I'd already recorded a video explaining image rehearsal therapy to my NP students. So I just literally sent them, that patient, the video. I had another patient who had OCD. And so she has treatment resistant OCD. So we started Mantine to help target the OCD. And I went through informed consent, of course, explained it to her. But like people always want other information, right? And they're going to Google stuff. So then to further that, I sent her an informational video that I had recorded on Memantine. So now she's getting to learn that stuff. She's getting to learn it from a credible source, right? Obviously, I trust myself. And now it's further strengthening the bond that we have as patient and doctor. So now she's feeling more comfortable. She feels heard, and she's more likely to follow through with what I say. And thus, she's more likely to get better. So there's only advantages to posting on social media and educating, and patients are only going to perceive it positively. Obviously, if it's done in a mature way, and I highly encourage you to do that if it's something that you are thinking about. Posting online on social media has changed my life, and now I'm here yapping about it because I hope that it can change your life too.